Well, the Texas Department of State Health Services announcing that they are aware of just the one case of malaria here in our state. They've also announced no infected mosquitoes have been found, but still, there's a lot of questions.
That's right. So joining us in today's Leading SA segment is Dr. Jason Bowling, infectious disease specialist with UT Health San Antonio. Good morning, Dr. Bowling. Thank you so much for joining us.
Good morning. Thank you for having me.
So, Dr. Bowling, for those who don't know, what is malaria and what should Texas families know about it?
Right. So malaria is a disease that's caused not by a bacteria or a virus, but a different type of germ called a protozoa. It is only transmitted by mosquitoes to people, so it's not transmitted from person to person. We see most of the cases in the world, about 95% of them are on the continent of Africa. We do see cases every year in the United States, but they're usually coming from people that have visited other areas where it transmits locally. So it is big news that we have a local case here in Texas. What it means for people here in Texas is, fortunately, the risk is extremely low. There's only been one case identified so far, and I think it's great news that we identified that one case. But it's important for people to recognize that mosquitoes are more than just a nuisance, right? More than just cause itchy bites. They can transmit disease. So malaria, West Nile virus has been detected in San Antonio. So people need to take precautions to protect themselves against mosquito bites, put on insect repellent, and try and empty any standing water that might be around your house. And flower pots is a popular area in those little dishes around your plants that are outside of the sun, or other areas where you may have water, standing baby pools, things like that.
Okay, to give our viewers a better understanding about malaria, is there a treatment for it? And also, I know that there's been studies about the malaria vaccine for those highly affected countries in Africa. So what can we ever expect that vaccine to be given here eventually in the future in the U.S.? And then if someone does get malaria in the U.S., how are they treated?
A great question. So malaria is a very treatable disease. The important thing is that it's identified and diagnosed, really. That's the key, because the medicines we use are a little bit different than the common antibiotics we use for other types of infections like pneumonia, skin and soft tissue infections. So it's important that people recognize it and identify it. And that's why the CDC has put out this early alert that it is a possibility. The symptoms, people can have fever, chills, nausea, vomiting, diarrhea. They're pretty nonspecific. That's why a lot of times people ask about travel, or now they'll ask about extensive time outdoors. The vaccine they've been working on a vaccine for a while. There's a lot of hope for a vaccine. Mosquitoes are the deadliest animal in the world. And every year they cause an estimated 700,000 deaths or more. So that's why they're working on this vaccine, because malaria is a big reason for that. It can cause severe disease and death. The vaccines are still kind of being studied. There's not one yet planned for the United States because we don't have that many cases here. Hopefully that will continue.
Now, you talked about people going outdoors. Obviously, this can be a huge weekend for people out and about grilling for Independence Day. What is your warning to families, not only about the possibility of malaria? We know it's a small possibility, but still, what about anything else that you guys are dealing with?
Very important for people to take precautions against the intense heat that we've been experiencing here for the beginning of this summer. As we know, it's hotter than usual. It's usually hot during Texas summer, but particularly hot now. It's important that people take precautions against heat exhaustion. We have seen cases of heat exhaustion at the emergency department. So we need people to wear loose-fitting clothes, stay hydrated, wear sun repellent, stay out of the direct sun if you can, and just be conscious. If you start having symptoms of lightheadedness, dizziness, nausea, those are early signs of heat exhaustion, and you need to get out of the sun, you need to get indoors, be drinking plenty of water.
Okay, so we also saw the CDC issued a health advisory for measles. What should parents be aware about for the situation?
Yes, unfortunately, the CDC has been pretty busy with some health advisory notices. There was a case of measles just southwest of Fort Worth, and this child that it was identified in had not really traveled. And so what the CDC is raised the alert. Really, it's important for people to recognize that we have an excellent vaccine against measles. Really, it's almost upper 90% as far as effective protecting against that disease. So people need to make sure that they're vaccinated. And then if they're traveling places, they need to look ahead. If you're going to go travel to a country abroad, you should look to see, do they have measles outbreaks? There's a lot of concern with the disruption we have with the COVID pandemic, that people might be off schedule with their immunizations. And then in some areas of Europe with the war, there are people that are off schedule as well. So there's a higher risk for measles transmission, and particularly for people that are traveling this summer.
And speaking of traveling, a lot of people traveling through the weekend. I think record numbers already being hit. I was just on a plane. I saw a lot of people wearing masks. Do you see masks as a permanent fixture of our society going forward?
So I look at it as a positive indicator that people recognize masks are an effective tool. And so everybody should do their own risk calculation. If they're at higher risk for infection or severe disease with respiratory viruses, they should consider it. Right now, fortunately, respiratory virus transmission is low. And so for most healthy people, that's not necessary. But if you've had a organ transplant or if you're on immunotherapy for chemotherapy, cancer or some other medical condition, you may be at high risk. And even though the transmission right now is low, we still are seeing cases of rhinovirus, which causes the common cold, SARS-CoV-2, which causes COVID, and even a few cases of influenza still low, but still available or still possible during the summer. And so, again, I think everybody should be encouraged to wear a mask if they feel comfortable doing so, if they want to do so. I don't think most normal, healthy people, immunocompetent people need to right now. But for those people that are at higher risk, it's something they should consider, and it's still very effective.
Well, Dr. Jason Bowling with UT Health San Antonio, always a pleasure having you on. So much important information. Thank you so much, Doctor, for your time this morning. For our viewers, you can find this interview in full later this morning on ksat.com.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.